Hello and welcome to Docplexus News. The UP government has recently banned the supply of Atorvastatin, a frequently used drug in cardiac diseases, after it failed the quality parameters. The drug was supplied to over 160 government hospitals and community health centers in UP. An order to list the entire batch of the medicine has also been dispensed. Further, a show cause notice has been issued to the Hyderabad-based supplier firm, and arrangements are being made to provide additional stock to meet the high demand of the drug. The US FDA has issued warning letters to 15 companies for the illegal sale of products containing cannabidiol in ways violating the Federal Food, Drug and Cosmetic Act. Based on the dearth of scientific information supporting the safety of CBD in food, the FDA has concluded that CBD is not safe for use in human or animal food. The FDA has also published a revised consumer update specifying the safety concerns of CBD products. The US FDA has recently granted accelerated approval to Voxelotor for the treatment of sickle cell disorder in adults and pediatric patients aged 12 years or more. The drug has received the orphan drug designation and is known to be an inhibitor of deoxygenated sickle hemoglobin polymerization. The approval was based on the results of a clinical trial of 274 patients. The effectiveness of the drug was based on an increase in hemoglobin response rate in patients who received the drug in comparison to the patients of the placebo group. Massachusetts has strictly banned the sale of flavored tobacco, e-cigarettes and vaping products, including menthol cigarettes, in response to a rise in tobacco-related severe lung disorders in the underaged and young generation. According to a recent study by the US government, the consumption of e-cigarettes has increased from 20.7% in 2018 to 27.5% in the present year. In order to support the ban, the legislature has placed a 75% excise tax on e-cigarettes. The UNICEF released Global Snapshot on Children. HIV and AIDS has reported that around 320 children and adolescents died every day due to AIDS-related causes in 2018. Negligence towards testing, low access to antiretroviral treatment, and limited prevention efforts are some of the important causes responsible for these deaths. The organization has also added that HIV initiatives need to be fully funded and equipped to preserve, protect, and improve the quality of life for children. Ahead of World AIDS Day, the New Zealand AIDS Foundation has launched the world's first perfectly safe HIV-positive sperm bank after the donation of semen samples from 3 HIV-positive donors. According to the online bank, each of the sperm donor was HIV-positive and had undergone successful antiretroviral therapy that resulted in a low and undetectable amount of the virus in the blood, which cannot be spread through unprotected sex or childbirth. This initiative will support HIV-positive persons to utilize their services. Recently, surgeons at hospital in Delhi have removed the world's largest kidney, which weighed about 7.4 kg, from a 56-year-old man. The kidney had occupied almost the entire abdomen of the patient and was removed after a 2-hour-long surgery. The patient was suffering from a genetic disorder called autosomal dominant polycystic kidney disease, where fluid-filled cysts build up in both kidneys, makes them swell, resulting in renal failure. Further, doctors from the hospital are now planning to apply for the Guinness World Record in connection with this particular surgery. A team of 5 doctors comprising of urologist Dr. R. Rajesh, gastroenterologist Dr. Kannan, Dr. Karthikeyan and Dr. Rajasekharan, and anesthetist Dr. Siva Kumar from the Mahatma Gandhi Memorial Government Hospital, Trichy, performed the first of its kind successful urethroplasty surgery, which lasted for 7 hours on a 55-year-old man. The patient suffered from a stricture urethra that prevented his natural urination for 2 years. The surgical procedure included cutting off the tube with vascularity from greater curvature of stomach and mobilizing the tube to the stricture site. The doctors added that the patient is doing well after 4 months of the surgery. The founder and CEO of Avya Fertility and IVF Center, Dr. Sahil Gupta was honored with the Fertility Game Changer of the Year award at the maiden edition of the National Fertility Awards 2019 in New Delhi. He is recognized for introducing low-cost IVF treatment in India. Avya has maintained efficiency, success and satisfaction rates and has provided an affordable IVF treatment at the same standard as in the best US and European clinics. The clinic has expanded to 7 locations all over the country. In today's date, Avya Clinic has become one of the busiest IVF clinics in New Delhi. Docplexus salutes Dr. Sahil Gupta and his efforts to improve healthcare affordability. Share your wishes in the comment section below. These were the latest happenings in the medical field brought to you by Docplexus, the global online community of doctors. Stay tuned for more every Thursday at 6 p.m. Happy Docplexing!